My name's Dr. Tracy Murrant. I'm a rehabilitation specialist. I'm a physician by training and I belong to the College of Physicians, and I subspecialise in rehabilitation medicine with a subspecialty in orthopaedic rehabilitation. That includes patients that have had post-op hip and knee replacements, shoulder replacements, ankle replacements, back surgery, cardiac surgery, and we also do some workers' compensation or trauma patients as well. Back when I was 27, I had an injury to my back and have had several operations on my back. I started initially doing physician training and swapped over to rehabilitation medicine because there was a gap in my recovery that I noticed that I could improve people's recovery post their surgeries. So a few of my friends who were doing rehabilitation had suggested that it would be a very good career choice to pursue. Oh, there is no typical day for me. It's very busy. As soon as I get here, I'm seeing inpatients, I'm seeing outpatients, I'm collaborating with the staff, the allied health members, which is the physios and the occupational therapists and the speech therapist, and to form a collaborative treatment plan for our patients. This hospital is a fantastic place to work at. The staff are so friendly and competent, and we work collaboratively and we communicate well with each other, and that's why we have such great outcomes, and that's why the patients love to keep coming back to this facility. So I've had lots of family members be patients here, and so has lots of the staff members, and it's just a wonderful place to work. There's usually two reasons why people have joint replacement surgeries. The first one is that their pain is uncontrollable with current analgesics. The second is if their function is deteriorated, so that they need to go and have the joint replacement to improve their functional level, including walking or being able to put on their clothes or showering independently. So that's usually the two main reasons why people have joint replacements. Listen to your doctors about any restrictions that you might have so that you don't get into trouble after your joint replacements. Do what they say. If there is an issue, go early and see a doctor, and keep up the good work and continue to do your exercises that have been provided for you. But if you need to have inpatient rehabilitation or outpatient rehabilitation, we're available to the public. From a patient's perspective is that all the health funds have different restrictions and contracts with different hospitals, so patients should be aware of what their health funds are allowing them to do. So they should really research in depth what they need to do before they pick a surgeon. So before they have the surgery, where they're going to have that surgery, and then which rehab facility they're allowed to come to. So they really need to either call us first to see if it's suitable for you to be a patient here, an inpatient or an outpatient, and whether we've got availability. Even if you get told we don't, you should always check with our staff members.